Professor Sala, you are a co-founder of Lucida Medical, which is an AI business that was set up 2 years ago. My understanding is that the first product that you will be launching is one based for prostate MRI. How will that help radiologists? How will it help urologists? How will it help the patient?
Yes, thank you. So the first product we have, it's called Pi, and it's a product that will help all the stakeholders because, first of all, address the clinical challenges, right? The product has to do this in order to be useful. So it will address the fact that we are detecting tumors late. So the tool will lead to early detection. It will be of high accuracy and reproducibility because it will, in inverted commas, will replace or be as good as an experienced radiologist. It will definitely help with the waiting lists due to COVID and other pressures that are on the NHS. Prostate has an extra sort of almost application because we put off a patient active surveillance, but that means more MRIs. It's great as a route for the patient because it's non-invasive and it avoids unnecessary procedures, but it means that they'll have follow-up MRIs, which will take their time to read and compare. So that will address that bottleneck on the NHS, which is important, and it will also address the time we spend on reviewing the MDT. I mean, it's estimated that each of us radiologists spend 2 hours of preparation for each hour of the MDT we're present, which all the MDTs are at least 2 hours, in my experience. So 2 out of 4, it's 6 hours, almost a full day you're dedicated to the MDT, which means that you're not reporting the cases that are coming through, for your everyday clinical practice. So that will help a lot because for the MDT, you compare a lot of studies coming from the other hospitals with different protocols, and the AI will be able to be our assistant in a way, sort of prepare it not just for reporting for the clinicians, but also for the MDT. So what Lucida has also has a very friendly report. It's a multimedia report that as a radiologist you can interact with it. And create a one-page report, which will really be used, of course, for the clinical purpose, but also as like a dashboard for the MDT, because you're going to have the information on any prior biopsy, if there was one, the PSA, all the other information you need, like family history, clinical details. You've got the MR report, and you've got also important images that show the lesion, if there is one, or dynamic course of the lesion, as well as annotated on a diagram that the urologists use for biopsy. So it will help the backlog, it will help obviously detection, active surveillance, biopsy when it's needed. It will help surgical planning because we will provide a 3D rendering of the prostate with the lesion. So the surgeon can plan the surgery as well as radiotherapy and of course focal therapies depending on the center. And all of these is absolutely adaptable depending on what each center's strength is in terms of what can be included in a report, if at all, depending on each center.